Let's check in with infectious disease specialist Dr. Zain Chagla with the latest developments of COVID-19, many of which. Good to see you this morning.
Good morning, Bob.
You contributed to an article that appeared in the Star and the Spectator on Monday. It was about changing the narrative on outdoor transmission. There is a lot of misinformation about that.
Yeah, I mean, I think we really talk about the few cases that occur outdoors and magnify them. And the reality is there for the few cases outdoors, there are thousands of cases indoors that are from situations where people can avoid gatherings and other pieces. The whole point was to say, listen, we shouldn't be shaming people for going outdoors. We shouldn't be shaming people for not wearing a mask outdoors. We should actually be embracing it and telling people, thank you for doing, your gathering outdoors, for meeting with someone outdoors. As long as you're following the precautions, as long as you know kind of how to mitigate your risk outdoors, I think it's something we should be encouraging people to do rather than necessarily saying, there's a risk and not giving anyone any options otherwise.
Yeah, it seems to be demonized, isn't it? Like being outside and gathering and having fun during a pandemic looks irresponsible, but this can drive people indoors and hiding away.
Exactly, right? I mean, I think that's it. If you don't change the messaging, it's a lot easier for people to gather indoors away from the public eye, and that's clearly not what we want out of all of this.
Yeah, I was actually at a drive-through and there was an exchange because they had the card reader out, on a stick, and someone leaned out to get the card on it and back in the car, and that started an exchange. And in the exchange, it was revealed they were both vaccinated. They both had masks on, and while it wasn't 6 feet, it was a good outdoor space between them. So while I'm waiting for my Dave's double combo, I'm thinking they're probably bickering about 0% transmission risk.
Yeah, exactly. And I think that's the thing. Like, we can breathe outdoors, we can relax outdoors a little bit, but we just have to change that narrative, right?
Yeah, it's a great ventilator. Now, there's also misinformation about extra vaccine in freezers not being used, but it's just the way the supply is going. Those freezers do get emptied. But AstraZeneca, different story, right?
Yeah, I mean, so many people are looking at the freezers and saying, why are they emptied? And again, most of the Pfizer doses are accounted for. We get about 400,000 a week, and we use about 400,000 a week. But the AstraZeneca doses, there was initial enthusiasm, but a lot of people are not getting them when they're accessible. There's lots of pharmacies that you walk in that call overhead and say, does anyone want an extra spot or two for AstraZeneca? I know there are risks with this vaccine. It's 1 in 100,000. What I will tell people is that there is a 94% reduction in hospitalization. And right now, where we are in Ontario, right now, when people are being flown 500 kilometers from their home to get care for COVID-19, everyone needs to do something to reduce their risk of hospitalization, whether it's public health or whether it's taking the vaccine when it's appropriate. The fact we're admitting 55-year-olds means that it was a vaccine preventable event 2 weeks ago. And so we really, really need people who are eligible to take AstraZeneca. They may be waiting for the right vaccine. It's not the time. If you get hospitalized, you are going to face care challenges in the coming weeks. There is one thing you can do: roll up your sleeve, take the shot. That will reduce that risk immensely in 2 weeks.
Okay, now the transmission rates in Ontario are actually making American news. Our COVID-19 case rate much higher, but you point out the death rate is still twice as high in the U.S.
Yeah, and there's different reasons, right? There's accessibility reasons. The vaccine rollout has had inequity issues in the United States. We're seeing huge outbreaks in Michigan, particularly amongst racialized and poor individuals. And so, there's that. There is obviously a BMI difference, and obesity being a big risk factor for decompensation. The US BMI is much higher than the Canadian BMI, and that also accounts for it. But, I think, many of us were shocked at the Canadian case rates. And realistically, that's not the only measure. We've been caring for the right people. We've been giving the vaccine appropriately. If things get worse, our death rates might go up, and I don't deny that. But I think, it's nice to be sensational about it. It's better to think about what we're doing well and how we're going to continue to do that as part of our response.
Yeah, well, the modeling's certainly alarming, but I hope we're in a better place when we chat next week. Thanks so much for joining us, Dr. Zain Chagla.